Also in Washington this morning is Howard Dean, former chairman of the Democratic National Committee. Dr. Dean, how are you this morning?
I'm very well, thank you.
Is healthcare dead?
I don't think so. I think the American people want health care reform. What they didn't want was something that was written by the insurance industries. And you know, this is a very Washington-centered proposal that finally came over to the House. And so I think they'll try again, put something in there that the American people want. The American people really do want us to do something about this.
The last time we talked, you said they should start over. Should they start over from scratch, or should they go and find what's salvageable? Say, for instance, making it illegal for insurances to deny protection to people with pre-existing conditions.
Well, you just heard John Boehner, the minority leader, say that they weren't going to vote for anything that we proposed. I would go back and do that, though, and I'd run it through the reconciliation program. You know, the Republicans are using this as a tactic to kill health care, to embarrass the president. That's not the right thing to do for America. America does need some real insurance reforms. You could simply expand the Medicare program that everybody knows to people who are over 55 instead of 65. The House and the Senate passed very good expansions of Medicaid, which helps young people, for example, and hardworking people who can't work for people who work for people with no insurance. Those are the kinds of things that you can do, and we can run those through reconciliation. The chairman of the Budget Committee in the Senate has already said he'd be willing to look at some things in the budget bill. I think we can get some decent. We can't get the whole thing, but I think we can get some good stuff done before the election.
Am I being Pollyanna to think that after all of this effort was put into this, and now it doesn't seem to be working, that both sides could sit down together and say, what do we really have in common, and work together to form something that might be palatable to help the 40-some million that don't have insurance, or the vast majority of the other folks who are one medical catastrophe away from bankruptcy?
Well, I always think that's worth trying. The president's tried awfully hard to get even one Republican to support this. They believe that if they obstruct this agenda, that they can benefit from it. And I think that's wrong for the country. But the Republicans have always been great at opposition, never very good at leadership. And so if we can work with the Republicans, we'd sure like to. But we've had our hand out for 6 months, and they've had no interest. I think we just need to get this done for the American people.
Dr. Howard Dean, Governor Dean, thank you very much for your time this morning. Do appreciate it, sir.